administrator, where you collect the premium from the government, because we all pay into the system, and then you pay the doctors and the hospitals for the care that's needed, and we get the insurance companies out of the industry of profitability, as well as making decisions on your health care when they should not even be in the room. That's how you solve better outcomes for not only rural area, for the veterans, and for the many of the women in this country that are denied care because of policies that don't fit right there with them.
So this is a two-pronged question, and I'll start with veterans and then I'll go into rural healthcare. So I have a little bit of a different take on the VA as somebody who is not only a veteran who has received care there, received the service connection there, but also as a VA employee for 10 years. The problem with the VA is not chaos, it's not disorganization, and it's definitely not VA employees who go to work every day trying to help their fellow citizens and try to help their country. The problem is that the VA is not properly funded. They don't have enough money to attract talent, to keep medical talent. When you can make more as a commercial physician than you can as a working in a VA hospital, that does put a strain when it comes to recruitment. When you look at the number of patients that are seen per day at a VA facility versus the number of patients that are seen per day at a commercial facility, we're going to need to keep pace with actually bringing in doctors, nurses, bringing in state-of-the-art equipment in order to actually provide our veterans with care. As has been stated before, we're running for Congress, right? Congress's principal job is the power of the purse, making sure that we fund the VA in addition to reforming it, in addition to making it more efficient, is going to be necessary in order to make sure that veterans receive proper care. What we need to do is highlight what we see in these DOGE cuts, literally poking holes in the organization, not an attempt to make it run more efficiently, but instead an attempt to bring it down so that you can privatize it and billionaires can make more money off of its rubble. As far as rural healthcare is concerned, it's been stated, and correctly so, that you cannot put together a small clinic that does not have the volume necessary to sustain itself in a rural area because people are dispersed. So we should do what has been done in other states and in other rural areas, and instead of trying to put together clinics, earmark funds, and encourage small business loans for folks who are going to have mobile healthcare centers where they bring the doctors and nurses and equipment to the patient. That's actually been shown to improve outcomes for preventative care, improve outcomes for primary care, put patients in a position where they can be seen regularly, which is in large part why those outcomes in rural areas are not as high. Secondly, when you're working in a rural area, whether you're a farmer, you're working with cattle, you're working with vegetables, strawberries, you can't afford to leave to go to the office for a day in order to get to see a doctor, because while you do that, who's tending to your farm? Who's taking care of your crops? Who's taking care of your livestock? So bringing the healthcare professionals to the patient has been shown to be more efficient, not just in terms of the provision of care, making sure that people have access to the care, but people are more likely to take advantage of it and to actually go.
Yeah, so similar to what they have said, we need to make sure that the necessary funding is available. If we need to reform it, whatever needs to be corrected, we have to correct it. There's no excuse. We have to make sure that we treat our veterans how they deserve. Especially, people who live in rural areas, a lot of times they're forgotten about. And we have to make sure that we don't forget about them. Because then we ask ourselves, why are they voting? And that's at work, because a lot of times we forget about rural folks. So we have to make sure the funding is available, that we don't leave anyone behind. And yeah, that's pretty much it.